Hi everybody, my name is LFullington. In this video, I will be discussing what health education means to me, why I chose to pursue a health education promotion minor in addition to my major in nursing, and how I plan to incorporate health education in the future. The basic definition of health education is teaching individuals and communities about health. The health education profession involves developing, implementing, and continuously analyzing learning opportunities, programs, and policies related to individual and public health. A health education specialist has a significant job in helping people gain the knowledge and skills necessary for making informed health decisions and performing beneficial health behaviors. Health education is really about knowledge and prevention. I am a firm believer in the idea that knowledge is power, not in the sense of superiority, but rather that it opens many doors in one's life, especially their health. I do not think one can make good health decisions if they do not have some understanding of health or are not presented with all their options. To me, this is the advantage of the health education profession. Individuals are given the opportunity to learn about health topics and how they can live their best and healthiest life. In my opinion, our healthcare industry seems to be more focused on treatment rather than prevention. This is why health education is so important, especially for younger generations. Educating about good health attitudes and behaviors from a young age can help establish and reinforce beneficial habits that have a better chance of being carried throughout life. I think we could see a positive change in the health of our society if we empowered people with knowledge of how they can prevent adverse health issues rather than accumulating bad health habits and waiting for symptoms to appear. Regarding my choice of major and minor, I always knew that I wanted to be in the medical field. I bounced around many career ideas, but ultimately decided on nursing around the start of high school. Around this time, my grandfather was diagnosed with pancreatic cancer. Spending time with him in the hospital gave me a little bit of insight into nursing. I was able to observe the nurses taking care of him and actually speak with them about the career. From this experience, I decided that I wanted to pursue a job in the nursing field where I could serve and make a positive difference in others' lives like these nurses did in my grandfather's life. A nurse I talked to had mentioned that TWU had one of the best nursing programs, so I felt confident in my school choice for my degree. This was my first semester to take classes towards a minor. I had finished all of my major's prerequisites and was in need of credit hours to meet a scholarship requirement. I really wanted to find a minor that would be complementary to my major. I ultimately decided on a health studies minor because the nursing profession involves educating and effectively communicating with patients about their health, and I want to be as proficient in these areas as I can be. After taking this course, I am really excited to see how I can apply the health education promotion knowledge I have gained in my future career as a nurse. One population I would like to work with is children. I believe that children are the future. Health education should start at a point when children are capable of understanding that their health choices impact their life. With this in mind, I think it would be wonderful to work in a school setting as a school nurse. I believe this setting would give me the opportunity to not only provide compassionate care, but also educate on health topics like eating nutritional school foods, combating food insecurity in children, preventing the spread of germs, etc. I would also like to work with underserved populations, especially homeless individuals whose health choices may be affected by factors such as affordability, accessibility, or lack of health care access. I think the homeless population in our society is greatly overlooked and treated with a lack of compassion. I agree with the idea that the health of individuals is interconnected with the overall health of their community. The homeless population is no less part of the community. Good health is deserved by everyone. If we wish to improve community health, we need to ensure that we are addressing the needs and issues of every population. Working in a community setting would provide me the opportunity to serve vulnerable populations and determine solutions for health issues like inability to afford nutritious foods, limited access to health care and grocery stores, etc. I think going into nursing with health education / promotion knowledge would help me be more well-rounded in the care I provide. Thank you for this semester and for listening to my video.